Is my severe sore throat and fever flu or strep throat? When you wake up with a terrible sore throat and a fever, it can be confusing to figure out what's causing it. Is it the flu or strep throat? Both can cause similar symptoms but have different causes and treatments. Let's explore how to tell them apart based on scientific understanding and medical guidelines. Influenza, or the flu, is a viral infection that spreads easily from person to person. It usually hits quickly, with symptoms like high fever, sore throat, cough, runny or stuffy nose, muscle aches, chills, and fatigue. The sore throat and flu is often part of a whole body illness, so you might also feel tired and achy all over. The fever tends to come on suddenly and can be quite high. Cough and nasal symptoms are common with the flu, and you might notice chills and body aches that make you feel very tired. Strep throat, on the other hand, is caused by bacteria called group A streptococcus. It tends to develop suddenly and is mostly focused on the throat. People with strep throat often experience a very severe sore throat that makes swallowing painful. They usually do not have cough or nasal congestion, which are more typical of the flu. The tonsils may look red and swollen, and sometimes white patches or streaks of pus can be seen on them. Swollen, tender lymph nodes in the neck are also common signs of strep throat. Distinguishing between the two involves looking at these key differences. With strep throat, symptoms are more localized to the throat and tend to appear quickly. You might notice a very sore throat with no cough or nasal symptoms. The presence of white patches on the tonsils and swollen lymph nodes points towards strep. In contrast, flu symptoms often include cough, runny nose, body aches, and fatigue, along with a sudden high fever. Because strep throat is caused by bacteria, it needs antibiotics to prevent complications like rheumatic fever. The flu, being viral, is usually managed with supportive care such as rest, fluids, and over-the-counter medications. Sometimes antiviral drugs are prescribed if caught early. It is possible, though rare, to have both infections at the same time, which can complicate diagnosis and treatment. If your sore throat is severe, especially if you have difficulty swallowing, high fever, white patches on your tonsils, or swollen neck glands, strep throat is more likely. If you also have cough, nasal congestion, muscle aches, and fatigue, the flu could be the culprit. Because symptoms overlap and both illnesses can be serious, it's best to see a healthcare provider. They may perform rapid tests or throat cultures to confirm if you have strep, and assess your overall condition to determine if antiviral treatment is needed for the flu. In summary, while both flu and strep throat can cause severe sore throat and fever, the key differences are the presence of cough and nasal symptoms in the flu, and the characteristic white patches and swollen lymph nodes in strep throat. Accurate diagnosis is important for effective treatment, so consulting a healthcare professional is always the safest choice. Remember, each person's experience can vary, so personalized medical advice is essential for proper care.